Assalamu alaikum. Today's topic of discussion is how to deal with history of pedal edema as a patient comes with heart failure. So first of all, in history of presenting illness, as you all know, in the first paragraph we go with OD para, that is the onset, duration, intensity, progression, association, and the relieving and aggravating factors. For example, a male patient, my patient, known case of hypertension and diabetes or whatsoever he had the comorbidities, presented with a complaint of bilateral pedal swelling, which was gradual in onset, 2 months in duration, bilateral or unilateral, progressive in nature, initially involving the bilateral foot, progressing upwards, involving the whole legs, the abdominal wall, and also the groin. There is history of pit formation by pressing on the swelling. The symptoms resolve on raising the legs and it increases on standing. The symptoms also resolve with taking water pills, but now they are not being resolved with the drugs. Association, you can mention there is no history of any skin changes, redness, itching, pain. This is the localized association. Then for the systemic association, if you are taking the patient history of pedal edema to the heart failure, then symptoms of heart failure, like there is history of shortness of breath, or so along with there is no history of any shortness of breath, or there is history of shortness of breath, then you can explain shortness of breath. There is history of any chest pain, any frothy sputum, any pain, right hypochondrium, any abdominal distension along with pedal edema. You are going to explain this as an association. Then comes the second paragraph, and you are going to rule out the other differential diagnosis, like other than heart failure there can be due to constrictive pericarditis, for which you are going to ask, there is mentioned that there is no distended neck veins or any past tuberculosis history, any previous history of family history of asthma or use of inhalers, or any whistling sounds in breath, any previous exposure to smoking, then fumes, biomass fuel, or any productive cough. So covering all those respiratory, any symptom of cor pulmonale leading to sleep disturbance, then any black tarry stools or any upper GI bleed, which you are going to ask in the form of blood in the vomitus, then any chronic diarrhea, any decreased weight, you can mention decreased weight leading to any previous diagnosis of malignancy, then decreased urine output, frothy urine. Then for autoimmune, no history of any oral ulcer, joint pain, skin tightening, difficulty in climbing the stairs or combing the hairs, then any use of any drugs like calcium channel blockers, any steroids, any NSAIDs, or any anti-diabetic drugs. Then in endocrine, you can mention that there is no history of any heat and cold intolerance, and any moon-like face, any use of steroids or Hakim medication, any weight gain, any excessive hair growth, then any previous surgery, any exposure to radiation, trauma, or any fracture. So these all are, you are going to rule out the differential diagnosis. Then comes in the care, you are going to ask first of all the etiology and the risk factors. If your patient is having diabetes or hypertension, you have to explain in detail when, how many years ago it was diagnosed, how it was diagnosed, who diagnosed it, what dietary medication, what dietary advice, what pharmacological treatment they are taking, whether he was on drug, now shifted on insulin or not, and he had been how he was investigated, have we done HbA1c level, and few complications of diabetes you have to mention here, because heart failure is the main cause can be diabetes, so you have to mention diabetes in detail here. Then similarly, hypertension, how it was diagnosed, for how long, what antihypertensive drug he has been taking, any complication due to hypertension that has occurred, you have to mention here. Then smoking, for how long he has been smoking, has he how many pack years, then has he ever tried to quit smoking, does he know the side effects of smoking, any recent event any recent myocardial infarction. Then you have to ask for dilated cardiomyopathy, in which any use of alcohol, any chemo or radiation, any previous recent flu-like symptoms for viral, then any high-risk sexual behavior, then for any previous family history of sudden cardiac death in age less than 40 years to rule out hukam. Then for restrictive cardiomyopathy, again tuberculosis, if you have asked one, you are not going to ask again. Then amyloidosis, you can ask if there is increase in tongue size, any painful nodules on the shin which heals on its own, any dry cough or a darkening of skin complexion or joint pains. If she is a female, you can ask for any pregnancy, previous recent pregnancy in the last 6 months. And then what event has occurred which has caused the flare if the patient was already a case of heart failure, like he was non-compliant to drug, either he developed some blood loss leading to anemia, he had some infection and fever, or there was some acute arrhythmia resulting in palpitation. You can ask if there is any new onset of chest pain, or he used NSAIDs or steroids or any other drug which has caused this new event. So you are going to cover all these in etiology and the risk factors. Then comes the complications, in which you are going to ask if there is any multi-organ involvement due to this cardiac event, which can be any renal, which can be any neurological, if he has developed any weakness, if he has any dizziness on standing like postural hypotension, if he has developed bilateral thrombosis of the legs. Then in the last paragraph, same as before, you are going to ask the investigations and treatments up till now. Then this was the after history of presenting illness. Then the past history, past medical, surgical, you have to ask along with any hospitalization. Then transfusion history is important, because if she is anemic, that can also lead to heart failure, and if there is excessive transfusion, that can also lead to heart failure. Then vaccination history, that's important in heart failure. Then sexual history, functional status, what activities he was able to do before and now what he is able to do. Self-care, occupational and household, everything you have to cover in the functional status. Then the socioeconomic status. So that's all for today. Thank you.